Welcome to the Burn Aid channel. Thank you for joining us. Today, we'll discuss how burns specifically affect the elderly. Burn injuries can be particularly severe and challenging for older adults due to various physiological factors. Let's explore the unique risks, complications, and care considerations for elderly burn patients. Increased risk factors in the elderly. Elderly individuals face higher risks of burn injuries due to factors like reduced mobility, sensory impairments, and slower reaction times. Common causes include kitchen accidents, hot water burns, and exposure to open flames. Additionally, thinner skin in older adults increases the likelihood of deeper burns and complications. Physiological changes and burn severity. Aging brings several physiological changes that affect burn severity and healing. Reduced skin elasticity and blood flow can exacerbate the depth and severity of burns. Slower cell regeneration and immune response in the elderly lead to delayed wound healing and increased risk of infection. Complications and health challenges. Burns in the elderly can lead to several complications, including 1. Infections, higher susceptibility to infections due to weakened immune systems. 2. Delayed healing, slower healing rates, making recovery more prolonged and complex. 3. Dehydration, increased risk due to fluid loss from burns and reduced physiological reserves. 4. Comorbidities, pre-existing health conditions like diabetes and heart disease, can complicate treatment and recovery. Psychological and social impact. Burn injuries can have a profound psychological impact on elderly patients. Feelings of isolation, anxiety, and depression may arise due to physical limitations and changes in appearance. Social support and mental health care are crucial for emotional well-being and recovery. Burn treatment considerations for the elderly. Treating burns in elderly patients requires special considerations, including 1. Gentle handling, due to fragile skin and potential for underlying medical conditions. 2. Pain management, careful selection of pain relief methods to avoid adverse effects. 3. Nutritional support, ensuring adequate nutrition to support healing and prevent complications. 4. Rehabilitation, physical therapy may be necessary to restore mobility and function. Preventing burns in the elderly. Preventive measures can significantly reduce the risk of burns among older adults. 1. Home safety, installing smoke detectors, using stove guards, and ensuring safe water temperatures. 2. Clothing, avoiding loose-fitting clothing near open flames. 3. Supervision, providing assistance during activities like cooking and bathing. 4. Education, teaching safe practices and emergency response measures to both the elderly and caregivers. Rehabilitation and recovery. Rehabilitation plays a vital role in the recovery of elderly burn patients. 1. Physical therapy, to regain strength and mobility, prevent contractures. 2. Occupational therapy, to assist with daily living activities and improve independence. 3. Psychological support, counseling to address mental health challenges. 4. Follow-up care, regular monitoring to manage long-term effects and prevent complications. The role of caregivers. Caregivers play an essential role in the care and recovery of elderly burn patients. 1. Daily assistance, helping with hygiene, dressing, and medical care. 2. Emotional support, providing comfort, encouragement, and companionship. 3. Health monitoring, observing for signs of infection or complications. 4. Advocacy, ensuring the patient receives appropriate medical and social services. Long-term effects and quality of life. Burn injuries can have long-term effects on the quality of life for elderly patients. 1. Physical limitations, reduced mobility and independence. 2. Chronic pain, persistent pain requiring ongoing management. 3. Skin changes, permanent scarring and changes in skin texture. 4. Psychosocial impact, coping with changes in appearance and social interactions. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the BurnAid app for free from the Play Store or App Store for more detailed guidance on burn care and first aid.